Have you guys noticed, either one of you, that we are using less contrast as compared to what we were using before?
You know exactly how much contrast you actually use, whereas with the manifold, you're spiking bottles, right? And with the bottles that are going on and off, the user has to make sure as they're drawing back there's no air bubbles. You're constantly worried, is there air in there? Oh, there is air in there. Okay, we got to prime that out, and you can focus on what's important during a STEMI and not have to futz with this manifold back and forth.
I think what's great too is like there's 5 syringes that you can use, right? So it's like you spike one big contrast bottle and it's just not wasted contrast. Yeah. It's not wasted material. We're not having to open up a new syringe for every single patient. So I think that also is a really big benefit. I think it's nice too because you're able to see exactly how much contrast is delivered. There's very specific, you can change the amount that you want delivered, and just I think makes it a lot quicker, honestly, easier from a tech point of view.
I think specifically a couple of years ago when we had the shortage of the contrast, it helped us a lot. We were able to still continue doing our high volume cases despite contrast shortage because of that.
It's amazing to see how little contrast we can use in a case. It's just the ability for it to be a safe and friendly and really easy to use on your standpoint makes it really an amazing piece of technology. And you've done a lot of cases with the manifold, and now you've done a lot of cases with the ACIST. What do you think is better? What do you think is easier or more efficient about it?
I think we definitely both has its pros and cons. Definitely the better things about ACIST, I would say, is the exact amount of contrast that you can deliver to your liking. So if, for example, if a patient comes in with elevated creatinine or renal insufficiency, and you want to be careful, so you can program the device to inject only 5 or 6 cc's per injection, which is sometimes difficult to judge when you're injecting with manifold. But this device will only inject certain amount. So I think decreasing the amount of contrast usage is known to be the most important factor in preventing contrast-induced nephropathy. So I really like it for that purpose.
The ACIST, if there's a bubble, there's an error and it won't let you inject. So I think that those errors on there are really helpful too for patient safety.
It's like a third party making sure that we're being as safe as possible. Right. So the last thing anyone wants in that room is an air embolus.
Yes, and there's a lot of prompts, because if you're going to inject a high volume contrast, then they will prompt you, are you sure?
Right.
So those are the safety things that ACIST does have that difficult to implement otherwise.
From day one, they were always present. They were there. They were extremely helpful. The number of people that were with us was maybe for like 2 or 3 weeks. Yeah. They walked us through every case, and they are still there. If we have an issue or we're running out of supplies, it's through a phone call or a text away, and all the issues are resolved really quickly. And that's been a really important thing for me, being in the cath lab lead role. If there's a problem with the technology, it's my responsibility to fix. So knowing that I have the support of the local reps and the company behind them, it makes my job a lot easier.